All right, so what are your concerns today?
Mostly my neck.
Okay.
Just kind of, more saggy than my face. I'm really concerned about trying to find something to just tighten up the turkey neck.
Okay, and have you done any procedures on your neck before?
No.
Okay. All right, is it okay if I just kind of...
Yes.
Okay. Okay, so what I'm doing is I'm checking to see, some people have fat pads under the neck and some people just have skin laxity.
Mm-hmm.
So I'm just kind of, seeing what's going on here. And it looks like yours is just skin laxity, which means just loose skin.
Mm-hmm.
Very normal. Unfortunately, kind of as we age, that's just kind of what happens.
Right.
A little bit kind of, you can see under the chin and then kind of where the head meets the neck over here. So you'd actually be a very good candidate for PDO Threads.
Okay, and what are those?
So they're made of a material called polydioxone, and it's a little tiny barbed thread. You can't really see it, but you could feel it if you were, feeling along the thread line. It's a really tiny suture material. It's what we use in heart surgery for the past 20 years or so. It's a slowly dissolving thread, so it dissolves over the next 4 to 6 months under the skin. In that time, it causes micro irritation. You will only feel kind of, tender and stuff, maybe a little irritation for the first week, but after that, you don't feel the micro irritation. But what it's doing is it's bringing collagen, your collagen building army, to your neck and restoring some collagen. Okay. So it's a regenerative procedure, which is great because it's kind of telling your body hey, do this on your own. And what I do is I numb up the area where I insert the thread, which is usually kind of more behind the neck, toward the back. I'll make sure you're numb. I make a little pilot hole with a needle, and then I gently thread the cannula down to kind of where I want it, which is usually just kind of past the midline of your neck. And when I pull the cannula out, the thread is in place. And then I will kind of trim the thread and kind of massage your neck and stuff like that to kind of set it. You'll see about a 20% result today if you were to do it today or on the first day. And over the next 4 to 6 months, you'll see the other 80% of results. So it's it kind of gets better and better and better over time.
Okay.
Putting the lidocaine as far as comfort and discomfort and things like that, putting the lidocaine in at the entrance where I'm going to create the entrance up here. It stings. It's like a little pinch and a burn if you've ever had any lidocaine anywhere. So that's mostly the only pain, although we do topical numbing before we do the lidocaine.
Okay.
Then we do the lidocaine at the injection sites. We can do Pronox, for people that are I don't really have a strong pain tolerance, or I'm nervous, or anything like that. If you feel any discomfort during the procedure, I can actually put lidocaine straight down the cannula at exactly where I am.
Okay.
So I'll stop what I'm doing, so you tell me, oh, it's uncomfortable here.
Okay.
Or it hurts, I need lidocaine.
Okay.
Usually people will make a face. If there's any discomfort, I'll stop.
Exactly.
Yeah, I'll stop before they say anything, and then I'm let me just put some down there.
Okay.
And it goes to right where you need it. A lot of times, if I'm going kind of across the jawline, that's the one spot I found to be kind of, where it can be sensitive, so sometimes I'll put a little bleb of lidocaine in there before I even start.
Okay.
Just to try and prevent discomfort.
Okay.
After the procedure, depending on if I cross your jawline at all, which I think for your neck, I don't think I really will cross your jawline, probably. But we'd play with the vectors of your face.
Okay.
But if I did cross your jawline, I would say no giant sandwiches, no big open mouth movements. Okay. You can do light exercise, but nothing crazy heavy over the next week or so.
Okay.
You might sometimes you get a little bit of bruising, usually not significant. Okay. Sometimes it'll feel tender like a bruise, but it won't show up like a bruise.
Okay.
It's usually minimal discomfort.
Okay. And
most people just go right back to work. They call it a lunchtime facelift or a lunchtime neck lift.
Sounds good.
So it lasts for about 18 months to 2 years. So it's really, really amazing, because a lot of these procedures you got to come back more frequently for, and this one, you're covered for a good while.
So once the they dissolve. They dissolve in 4 to 6 months, but the effects are for about 18 months.
Yeah, 18 months to 2 years. So the collagen that's kind of built around that area, like stays there, you know, and it doesn't start to kind of, you know, go away for about a year and a half after the threads are dissolved. So even having the collagen there kind of brings a little bit more collagen to the area. And there's some other procedures that we can do that stimulate the collagen that's already there to like bring more collagen.
Okay.
Yeah.
So with the neck lift, does that include kind of the jowl line here?
Yes, because, well, depending on the patient, but since, you know, this is kind of part of your neck, under here, under your chin, I can see that I'm getting some good pull, like by starting up at your jawline and kind of wrapping around to your neck. So you kind of get a little bit of a jowl lift as a bonus.
Okay.
And that doesn't, you know, it's not the best angle for everybody, but in kind of playing with the vectors of your face, I can see that that's a really good angle for us.
Okay.
So it might lift a little bit of the jowl, which is just kind of a bonus, but it really streamlines your jawline. And I mean, your lower neck is very smooth, you know, not much laxity down here. So I don't think we'll need to like do threads all the way down.
Okay, perfect.
So it's probably 4 to 6
Okay.
threads, and we can take breaks and pause and different things like that. And we'll make sure you're comfortable, and you know, I'll talk you through the procedure if you choose to do it.
Okay.
And kind of, you know, let you know like, okay, you're gonna feel pressure this time, or, you know, so on and so forth, or like, I'm gonna put my hand and do pressure, or the cannula's out. That's my favorite. When I'm getting anything done, I'm like, when is everything out?
Right.
You
Like
know.
the dentist.
Yes.
Yes.
Like, you're done, right? Yes.
So if we're doing 4 to 6 threads, about how long does that take?
Probably about 45 minutes. That includes me kind of, you know, playing with the vectors of your face, drawing it out, numbing you up, everything, yeah.
Okay.
Up to an hour. It just depends, like if you needed a little breather break or something.
Okay. All right.
And the numbing process prior to, which, you know, some people will come and get numbing cream and then go back out and run a couple errands and then come back, or they'll just kind of, you know, lounge in one of our quiet rooms. So that's an additional like 30 to 45 minutes if you wanted topical. You don't need to get topical, but if you're nervous and you think that would make it a little better, I would go ahead and get the topical numbing cream, and then we'll clean that off and then do the injectable as well.
Sounds good.
Okay, awesome. So do you think that's something you'd be interested in?
Absolutely.
Okay, when would you like to do it?
As soon as you can.
All right. Well, I do have some time today, so let's get you numbed up and get you started.
Let's do it.
Awesome. PDO Thread Lift is a minimally invasive way to create kind of a lunchtime facelift. Immediately, our lift is about 20%. Over the next 4 to 6 months, the result improves. First, we'll get you some topical lidocaine, get you comfortable. Then I will put a little bit of injectable lidocaine at the site where I'm going to put the thread in. I'll make sure that you're numb. I then create a little bit of a pilot hole with a needle, and then thread the cannula through, anchor the thread, pull the cannula out, and that's your first thread in. We repeat that process as many times as we need to achieve our result, which is typically about 4 threads in the brow and typically 4 to 8 threads for the neck.
If you like what you see, you can book a treatment with us today or call to schedule your complimentary consultation, and we can help you with all of your skin and body needs.